Alright guys, so let's continue on Man's Search for Meaning by Viktor Frankl. The meaning of love. Love is the only way to grasp another human being in the innermost core of his personality. No one can become fully aware of the very essence of another human being unless he loves him or her. By his love, he is enabled to see the essential traits and features in the beloved person, and even more, he sees that which is potential in him, which is not yet actualized but yet ought to be actualized. Furthermore, by his love, the loving person enables the beloved person to actualize these potentialities. By making him aware of what he can be and of what he should become, he makes these potentialities come true. In logotherapy, love is not interpreted as a mere epiphenomenon of sexual drives and instincts in the sense of a so-called sublimation. Love is as primary a phenomena as sex. Normally, sex is a mode of expression for love. Sex is justified, even sanctified, as soon as, but only as long as, it is a vehicle of love. Thus, love is not understood as a mere side effect of sex. Rather, sex is a way of expressing the experience of that ultimate togetherness which is called love. The third way of finding a meaning in life is by suffering. The meaning of suffering. We must never forget that we may also find meaning in life even when confronted with a hopeless situation, when facing a fate that cannot be changed. For what then matters is to bear witness to the uniquely human potential at its best, which is to transform a personal tragedy into a triumph, to turn one's predicament into a human achievement. When we are no longer able to change a situation, just think of an incurable disease such as inoperable cancer. We are challenged to change ourselves. Let me cite a clear-cut example. Once an elderly general practitioner consulted me because of his severe depression. He could not overcome the loss of his wife, who had died 2 years before and whom he had loved above all else. Now, how could I help him? What should I tell him? Well, I refrained from telling him anything, but instead confronted him with the question, what would have happened, doctor, if you had died first and your wife would have had to survive you? Oh, he said, for her this would have been terrible, how she would have suffered. Whereupon I replied, you see, doctor, such a suffering has been spared her, and it was you who have spared her this suffering. To be sure, at the price that now you have to survive and mourn her. He said no word but shook my hand and calmly left my office. In some ways, suffering ceases to be suffering at the moment it finds a meaning, such as the meaning of a sacrifice. Of course, this was no therapy in the proper sense, since first, his despair was no disease, and second, I could not change his fate. I could not revive his wife. But in that moment, I did succeed in changing his attitude toward his intolerable fate, inasmuch as from that time on he could at least see a meaning in his suffering. It is one of the basic tenets of logotherapy that man's main concern is not to gain pleasure or to avoid pain, but rather to see a meaning in his life. That is why man is even ready to suffer on the condition to be sure that his suffering has a meaning. But let me make it perfectly clear that in no way is suffering necessary to find meaning. I only insist that meaning is possible even in spite of suffering, provided certainly that the suffering is unavoidable. If it were avoidable, however, the meaningful thing to do would be to remove its cause, because it's psychological, biological, or political. Albeit psychological, biological, or political. To suffer unnecessarily is masochistic rather than heroic. Edith Weisskopf Jolson, before her death professor of psychology at the University of Georgia, contended in her article on logotherapy that our current mental hygiene philosophy stresses the idea that people ought to be happy. that unhappiness is a symptom of maladjustment. Such a value system might be responsible for the fact that the burden of unavoidable unhappiness is increased by unhappiness about being unhappy. And in another paper, she expressed the hope that logotherapy may help counteract certain unhealthy trends in the present-day culture of the United States, where the incurable sufferer is given very little opportunity to be proud of his suffering and to consider it ennobling rather than degrading, so that he is not only unhappy, but also ashamed of being unhappy. There are situations in which one is cut off from the opportunity to do one's work or to enjoy one's life, but what never can be ruled out is the unavoidability of suffering. In accepting this challenge to suffer bravely, life has a meaning up to the last moment, and it retains this meaning literally to the end. In other words, life's meaning is an unconditional one, for it even includes the potential meaning of unavoidable suffering. Let me recall that which was perhaps the deepest experience I had in the concentration camp. The odds of surviving the camp were no more than 1 in 28, as can easily be verified by exact statistics. It did not even seem possible, let alone probable, that the manuscript of my first book, which I had hidden in my coat when I arrived at Auschwitz, would ever be rescued. Thus, I had to undergo and to overcome the loss of my mental child. And now it seemed as if nothing and no one would survive me, neither a physical nor a mental child of my own. So I found myself confronted with the question whether under such circumstances my life was ultimately void of any meaning. Not yet did I notice that an answer to this question with which I was wrestling so passionately was already in store for me, and that soon thereafter this answer would be given to me. This was the case when I had to surrender my clothes and in turn inherited the worn-out rags of an inmate who had already been sent to the gas chamber immediately after his arrival at the Auschwitz railway station. Instead of the many pages of my manuscript, I found in a pocket Instead of the many pages of my manuscript, I found in a pocket of the newly acquired coat one single paper torn out of a Hebrew prayer book containing the most important Jewish prayer, Shema Yisrael. How should I have interpreted such a coincidence other than as a challenge to live my thoughts instead of merely putting them on paper? A bit later, I remember it seemed to me that I would die in the near future. In this critical situation, however, my concern was different from that of most of my comrades. Their question was, will we survive the camp? For if not, all this suffering has no meaning. The question which beset me was, has all this suffering, this dying around us, a meaning? For if not, then ultimately there is no meaning to survival, for a life whose meaning depends upon such a happenstance as whether one escapes or not ultimately would not be worth living at all. Meta-clinical problems. More and more a psychiatrist is approached today by patients who confront him with human problems rather than neurotic symptoms. Some of the people who nowadays call on a psychiatrist would have seen a pastor, priest, or rabbi in former days. Now they often refuse to be handed over to a clergyman and instead confront the doctor with questions such as, what is the meaning of my life? A logodrama. I should like to cite the following instance. Once, the mother of a boy who had died at the age of 11 years was admitted to my hospital department after a suicide attempt. Dr. Kurt Kokorek invited her to join a therapeutic group, and it happened that I stepped into the room where he was conducting a psychodrama. She was telling her story. At the death of her child, her son, she was left alone with another, older son who was crippled, suffering from the effects of infantile paralysis. The poor boy had to be moved around in a wheelchair. His mother, however, rebelled against her fate. But when she tried to commit suicide together with him, it was the crippled son who prevented her from doing so. He liked living. For him, life had remained meaningful. Why was it not so for his mother? How could her life still have a meaning, and how could we help her to become aware of it? Improvising, I participated in the discussion and questioned another woman in the group. I asked her how old she was, and she answered 30. I replied, no, you are not 30, but instead 80 and lying on your deathbed. And now you are looking back on your life, a life which was childless but full of financial success and social prestige. And then I invited her to imagine what she would feel in this situation. What will you think of it? What will you say to yourself? Let me quote what she actually said from a tape which was recorded during that session. "Oh, I married a millionaire. I had an easy life full of wealth, and I lived it up. I flirted with men, I teased them, but now I am 80. I have no children of my own. Looking back as an old woman, I cannot see what all that was for. Actually, I must say, my life was a failure." I then invited the mother of the handicapped son to imagine herself similarly looking back over her life. Let us listen to what she had to say as recorded on the tape. "I wished to have children, and this wish had been granted to me. One boy died, the other, however, the crippled one, would have been sent to an institution if I had not taken over his care. Though he is crippled and helpless, he is after all my boy, and so I have made a fuller life possible for him. I have made a better human being out of my son." At this moment there was an outburst of tears and crying. She continued, "As for myself, I can look back peacefully on my life, for I can say my life was full of meaning, and I have tried hard to fulfill it. I have done my best. I have done the best for my son. My life was no failure." Viewing her life as if from her deathbed, she had suddenly been able to see a meaning in it, a meaning which even included all of her sufferings. By the same token, however, it had become clear as well that a life of short duration, like that, for example, of her dead boy, could be so rich in joy and love that it could contain more meaning than a life lasting 80 years. After a while, I proceeded to another question, this time addressing myself to the whole group. The question was whether an ape which was being used to develop poliomyelitis serum, and for this reason punctured again and again, would ever be able to grasp the meaning of its suffering. Unanimously, the group replied that of course it would not. With its limited intelligence, it cannot enter into the world of man, i.e., the only world in which the meaning of its suffering would be understandable. Then I pushed forward with the following question. "And what about man? Are you sure that the human world is a terminal point in the evolution of the cosmos? Is it not conceivable that there is still another dimension, a world beyond man's world, a world in which the question of an ultimate meaning of human suffering would find an answer?" The dogs are annoying. I think the neighbor's fucking doing something. Neighbors. The super meaning. This ultimate meaning necessarily exceeds and surpasses the finite intellectual capacities of man. In logotherapy, we speak in this context of a super meaning. What is demanded of man is not, as some existential philosophers teach, to endure the meaninglessness of life, but rather to bear his incapacity to grasp its unconditional meaningfulness in rational terms. Logos is deeper than logic. A psychiatrist who goes beyond the concept of the super meaning will sooner or later be embarrassed by his patients, just as I was when my daughter at about 6 years of age asked me the question, "Why do we speak of the good Lord?" Whereupon I said, "Some weeks ago you were suffering from measles, and then the good Lord sent you full recovery." However, the little girl was not content. She retorted, "Well, but please, Daddy, do not forget, in the first place, he had sent me the measles." However, when a patient stands on the firm ground of religious belief, there can be no objection to making use of the therapeutic effect of his religious convictions, and thereby drawing upon his spiritual resources. In order to do so, the psychiatrist may put himself in the place of the patient. That is exactly what I did once, for instance, when a rabbi from Eastern Europe turned to me and told me his story. He had lost his first wife and their 6 children in the concentration camp of Auschwitz, where they were gassed, and now it turned out that his second wife was sterile. I observed that procreation is not the only meaning of life, for then life in itself would become meaningless, and something which in itself is meaningless cannot be rendered meaningful merely by its perpetuation. However, the rabbi evaluated his plight as an Orthodox Jew in terms of despair that there was no son of his own who would ever say Kaddish for him after his death. Kaddish is a prayer for the dead. But I would not give up. I made a last attempt to help him by inquiring whether he did not hope to see his children again in heaven. However, my question was followed by an outburst of tears, and now the true reason for his despair came to the fore. He explained that his children, since they died as innocent martyrs, were thus found worthy of the highest place in heaven. But as for himself, he cannot expect as an old sinful man to be assigned the same place. I did not give up, but retorted, "Is it not conceivable, Rabbi, that precisely this was the meaning of your surviving your children, that you may be purified through these years of suffering, so that finally you too, though not innocent like your children, may become worthy of joining them in heaven? Is it not written in the Psalms that God preserves all your tears? So perhaps none of your sufferings were in vain." For the first time in many years, he found relief from his suffering through the new point of which I was able to open up to him. Life's transitoriness. Those things which seem to take meaning away from human life include not only suffering, but dying as well. I never tire of saying that the only really transitory aspects of life are the potentialities, but as soon as they are actualized, they are rendered realities at that very moment. They are saved and delivered into the past, wherein they are rescued and preserved from transitoriness. For in the past, nothing is irretrievably lost, but everything irrevocably stored. Thus, the transitoriness of our existence in no way makes it meaningless, but it does constitute our responsibleness, for everything hinges upon our realizing the essentially transitory possibilities. Man constantly makes his choice concerning the mass of present potentialities, which of these will be condemned to non-being and which will be actualized. Which choice will be made in actuality once and forever, an immortal footprint in the sands of time. At any moment, man must decide, for better or for worse, what will be the monument of his existence. Usually, to be sure, man considers only the stubble field of transitoriness and overlooks the full granaries of the past, wherein he had salvaged once and for all his deeds, his joys, and all his sufferings. Nothing can be undone, and nothing can be done away with. I should say, having been is the surest kind of being. Logotherapy, keeping in mind the essential transitoriness of human existence, is not pessimistic but rather activistic. To express this point figuratively, we might say, the pessimist resembles a man who observes with fear and sadness that his wall calendar, from which he daily tears a sheet, grows thinner with each passing day. On the other hand, the person who attacks the problems of life actively is like a man who removes each successive leaf from his calendar and files it neatly and carefully away with its predecessors, after first having jotted down a few diary notes on the back. He can reflect with pride and joy on all the richness set down in these notes, on all the life he had already lived to the fullest. What will it matter to him if he notices that he is growing old? Has he any reason to envy the young people whom he sees, or wax nostalgic over his own lost youth? What reasons has he to envy a young person for the possibilities that a young person has, the future which is in store for him? No, thank you, he will think. Instead of possibilities, I have realities in my past, not only the reality of work done and of love loved, but of sufferings bravely suffered. These sufferings are even the things of which I am most proud, though these are things which cannot inspire envy. Logotherapy as a technique. A realistic fear, like the fear of death, cannot be tranquilized away by its psychodynamic interpretation. On the other hand, a neurotic fear such as agoraphobia cannot be cured by philosophical understanding. However, logotherapy has developed a special technique to handle such cases too. To understand what is going on whenever this technique is used, we take as a starting point a condition which is frequently observed in neurotic individuals, namely anticipatory anxiety. It is characteristic of this fear that it produces precisely that of which the patient is afraid. An individual, for example, who is afraid of blushing when he enters a large room and faces many people will actually be more prone to blush under these circumstances. In this context, one might amend the saying, the wish is father to the thought. In this context, one might amend the saying, the wish is father to the thought, to the fear is mother of the event. Ironically enough, in the same way that fear brings to pass what one is afraid of, likewise a forced intention makes impossible what one forcibly wishes. This excessive intention of hyperintention, as I call it, can be observed particularly in cases of sexual neurosis. The more a man tries to demonstrate his sexual potency or a woman her ability to experience orgasm, the less they are able to succeed. Pleasure is and must remain a side effect or byproduct and is destroyed and spoiled to the degree to which it is made a goal in itself. In addition to excessive intention as described above, excessive attention or hyperreflection as it is called in logotherapy may also be pathogenic, that is, lead to sickness. The following clinical report will indicate what I mean. A young woman came to me complaining of being frigid. The case history showed that in her childhood she had been sexually abused by her father. However, it had not been this traumatic experience in itself which had eventuated in her sexual neurosis, as could easily be evidenced, for it turned out that through reading popular psychoanalytic literature, the patient had lived constantly with the fearful expectation of the toll which her traumatic experience would someday take. This anticipatory anxiety resulted both in excessive intention to confirm her femininity and excessive attention centered upon herself rather than upon her partner. This was enough to incapacitate the patient for the peak experience of sexual pleasure, since the orgasm was made an object of intention and an object of attention as well, instead of remaining an unintended effect of unreflected dedication and surrender to the partner. After undergoing short-term logotherapy, the patient's excessive attention and intention of her ability to experience orgasm had been de-reflected. To introduce another logotherapeutic term, when her attention was refocused toward the proper object, i.e. the partner, orgasm established itself spontaneously. Logotherapy bases its technique called paradoxical intention on the twofold fact that fear brings about that which one is afraid of, and that hypertension makes impossible what one wishes, and that hypertension or hyperintention makes impossible what one wishes. In German, I described paradoxical intention as early as 1939. In this approach, the phobic patient is invited to intend, even if only for a moment, precisely that which it fears. Let me recall a case. A young physician consulted me because of his fear of perspiring. Whenever he expected an outbreak of perspiration, this anticipatory anxiety was enough to precipitate excessive sweating. In order to cut this circle formation, I advised the patient, in the event that sweating should recur, to resolve deliberately to show people how much he could sweat. A week later, he returned to report that whenever he met anyone who triggered his anticipatory anxiety, he said to himself, I only sweated out of court before, but now I'm going to pour at least 10 quarts. The result was that after suffering from his phobia for 4 years, he was able, after a single session, to free himself permanently of it within 1 week. The reader will note that this procedure consists of a reversal of the patient's attitude, inasmuch as his fear is replaced by a paradoxical wish. By this treatment, the wind is taken out of the sails of the anxiety. Such a procedure, however, must make use of the specifically human capacity for self-detachment inherent in a sense of humor. This basic capacity to detach one from oneself is actualized whenever the logotherapeutic technique called paradoxical intention is applied. At the same time, the patient is enabled to put himself at a distance from his own neurosis. A statement consistent with this is found in Gordon W. Allport's book, The Individual and His Religion. The neurotic who learns to laugh at himself may be on the way to self-management, perhaps the cure. Paradoxical intention is the empirical validation and clinical application of Allport's statement. A few more case reports may serve to clarify this method further. The following patient was a bookkeeper who had been treated by many doctors and in several clinics without any therapeutic success. When he was admitted to my hospital department, he was in extreme despair, confessing that he was close to suicide. For some years, he had suffered from a writer's cramp, which had recently become so severe that he was in danger of losing his job. Therefore, only immediate short-term therapy could alleviate the situation. In starting treatment, Dr. Eva Kozdera recommended to the patient that he do just the opposite of what he usually had done. Namely, instead of trying to write as neatly and legibly as possible, to write with the worst possible scrawl. He was advised to say to himself, "Now I will show people what a good scribbler I am." And at that moment in which he deliberately tried to scribble, he was unable to do so. "I tried to scrawl, but simply could not do it," he said the next day. Within 48 hours, the patient was in this way freed from his writer's cramp and remained free for the observation period after he had been treated. He is a happy man again and fully able to work. A similar case, dealing, however, with speaking rather than writing, was related to me by a colleague in the laryngological department of the Vienna Polyclinic Hospital. It was the most severe case of stuttering he had come across in his many years of practice. Never in his life, as far as the stutterer could remember, had he been free from his speech trouble even for a moment, except once. This happened when he was 12 years old and had looked... That's fucking bewildered. Alright, so in a similar case, dealing, however, with speaking rather than writing, was related to me by a colleague in the laryngological department of the Vienna Polyclinic Hospital. It was the most severe case of stuttering he had come across in his many years of practice. Never in his life, as far as the stutterer could remember, had he been free from his speech trouble, even for a moment, except once. This happened when he was 12 years old and had hooked a ride on a streetcar. When caught by the conductor, he thought that the only way to escape would be to elicit his sympathy, and so he tried to demonstrate that he was just a poor stuttering boy. At that moment when he tried to stutter, he was unable to do it. Without meaning to, he had practiced paradoxical intention, though not for therapeutic purposes. However, this presentation should not leave the impression that paradoxical intention is effective only in monosymptomatic cases. By means of this logotherapeutic technique, my staff at the Vienna Polyclinic Hospital has succeeded in bringing relief even in obsessive-compulsive neuroses of a most severe degree and duration. I refer, for instance, to a woman 65 years of age who had suffered for 60 years from a washing compulsion. Dr. Eva Kozdera started logotherapeutic treatment by means of paradoxical intention, and 2 months later the patient was able to lead a normal life. Before admission to the neurological department of the Vienna Polyclinic Hospital, she had confessed, "Life was hell for me." Handicapped by her compulsion and bacteriophobic obsession, she finally remained in bed all day, unable to do any housework. It would not be accurate to say that she is now completely free of symptoms, for an obsession may come to her mind. However, she is able to joke about it, as she says, in short, to apply paradoxical intention. Paradoxical intention can also be applied in cases of sleep disturbance. The fear of sleeplessness results in a hyper-intention to fall asleep, which in turn incapacitates the patient to do so. To overcome this particular fear, I usually advise the patient not to try to sleep, but rather try to do just the opposite. That is, to stay awake as long as possible. In other words, the hyper-intention to fall asleep arising from the anticipatory anxiety of not being able to do so must be replaced by the paradoxical intention not to fall asleep, which soon will be followed by sleep. Paradoxical intention is no panacea, yet it lends itself as a useful tool in treating obsessive-compulsive and phobic conditions, especially in cases with underlying anticipatory anxiety. Moreover, it is a short-term therapeutic device. However, one should not conclude that such a short-term therapy necessarily results in only temporary therapeutic effects. One of the more common illusions of Freudian orthodoxy, to quote the late Emil A. Guthel, is that the durability of results corresponds to the length of therapy. In my files, there is, for instance, the case report of a patient to whom paradoxical intention was in my files, there is, for instance, the case report of a patient to whom paradoxical intention was administered more than 20 years ago. The therapeutic effect proved to be nevertheless a permanent one. One of the most remarkable facts is that paradoxical intention is effective regardless of the etiological basis of the case concerned. This confirms a statement once made by Edith Woskop-Johnson. Although traditional psychotherapy has insisted that therapeutic practices have to be based on findings on etiology, it is possible that certain factors might cause neurosis during early childhood and that entirely different factors might relieve neurosis during adulthood. As for the actual causation of neurosis, apart from constitutional elements, whether somatic or psychic in nature, such feedback mechanisms as anticipatory anxiety seem to be a major pathogenic factor. A given symptom is responded to by a phobia. The phobia triggers a symptom, and the symptom in turn reinforces the phobia. A similar chain of events, however, can be observed in obsessive-compulsive cases in which the patient fights the ideas which haunt him. Thereby, however, he increases their power to disturb him, since pressure precipitates counter-pressure. Again, the symptom is reinforced. On the other hand, read that again anyway. One of the most remarkable facts is that paradoxical intention is effective regardless of the etiological basis of the case concerned. This confirms a statement once made by Edith Woskop-Johnson. Although traditional psychotherapy has insisted that therapeutic practices have to be based on findings on etiology, it is possible that certain factors might cause neuroses during early childhood and that entirely different factors might relieve neurosis during adulthood. As for the actual causation of neuroses, apart from constitutional elements, whether somatic or psychic in nature, such feedback mechanisms as anticipatory anxiety seem to be a major pathogenic factor. A given symptom is responded to by a phobia. The phobia triggers a symptom, and the symptom in turn reinforces the phobia. A similar chain of events, however, can be observed in obsessive-compulsive cases in which the patient fights the ideas which haunt him. Thereby, however, he increases their power to disturb him, since pressure precipitates counter-pressure. Again, the symptom is reinforced. On the other hand, as soon as the patient stops fighting his obsessions and instead tries to ridicule them by dealing with them in an ironical way, by applying paradoxical intention, the vicious circle is cut, the symptom diminishes and finally atrophies. The vicious circle is cut, the symptom diminishes and finally atrophies. In the fortunate case where there is no existential vacuum which invites and elicits the symptom, the patient will not only succeed in ridiculing his neurotic fear, but finally will succeed in completely ignoring it. Or in the fortunate case where there is no existential vacuum which invites and elicits the symptom, the patient will not only succeed in ridiculing his neurotic fear, but finally will succeed in completely ignoring it. As we see, anticipatory anxiety has to be counteracted by paradoxical intention. Hyperintention, as well as hyperreflection, have to be counteracted by dereflection. Dereflection, however, ultimately is not possible except by the patient's orientation toward a specific vocation and his mission in life. It is not the neurotic self-concern, whether pity or contempt, which breaks the circle formation. The cue to cure is self-transcendence. The cue to cure is self-transcendence. It is not the neurotic self-concern, whether pity or contempt, which breaks the circle formation. The cue to cure is self-transcendence. So, for example, I suffer this fear, right? Fear of other people, or a person of a sort of personality trait, or it triggers a sense of, alertness in me. And so when you see, if somebody triggers you, you're so, don't be triggered, don't be triggered. You're trying to have too much of an intention to be courageous. Be courageous. Don't get angry. Don't. But that what do you call it? Super intention, hyper intention. Hyper reflection. It's only going to make you have more fear. So in that example of someone who's afraid that I'm not going to fall asleep. Fall asleep. I have this deep intention to fall asleep. Try to focus and fall asleep. Focus and fall asleep. And you don't fall asleep. I'm saying, no, I'm going to stay up. Stay up. So in that sense, let's say if you're afraid of something, do you try to be afraid of it? Do you try to be afraid of it more? Or are you supposed to tell yourself, I'm not afraid of it. I'm not afraid of it. But if you tell yourself, I'm not afraid of it, but you are afraid of it, you have a phobia of it, you keep telling yourself, I'm not afraid of it, isn't that like you telling yourself, I'm trying to go to sleep, go to sleep, go to sleep? It's kind of confusing, huh? I don't know. Paradoxical intention. Anyway, I'll stop there.